let's start with evaluation station first. So let's compare them. So if you're taking the old examination, the Legacy 2014, you will be given 15 minutes, okay? You will be given 15 minutes. If you're taking the new test of competence, which predominantly of you are taking in the next coming days or weeks, you will only be given 8 minutes, okay? If you're doing the legacy examination, it's a written station. If you're taking the new test of competence, it's a verbally assessed station, okay? So your writing will not be marked. So whatever you're saying to the assessor are the only things that will matter on the examination. And you will be using a blue pen, okay? So if we recall, our assessment station, you are using a green pen. On your planning station, you're using a black pen. On your implementation station, you're using a black pen. On this last station, you will be using a blue pen. So you will not have any opportunity to change your answers, okay? That is it. Any question at this point? So that should be straightforward and easy, right? Okay. So we will now discuss the marking criteria. So how are you actually going to pass the station? Okay, when we're doing our webinars, I only like focus on the marking criteria, okay, when it's actually needed to pass the examination. All right. So let's start with the Legacy 2014. It will be a 15-minute station. It's a written station, and your main tasks are the following. It's either of the following. It's either you're writing a transfer of care letter or a referral letter, okay? So those are your possible tasks when you're writing this station. So the first criteria on your evaluation station is to clearly describe the reason for initial admission, referral to specialist team, and diagnosis. So as you can see on your screen, this is the actual paper on the examination. It says here, transfer of care letter. Let's pretend our patient is Mr. John Snow and his hospital number is 1 to 7. The patient's date of birth is 25th to 10, 1982. This section of your document already been completed. So the first criteria is to clearly describe the reason for admission. So of course, the possible answers that you could write here are the following. Let's say the patient was admitted due to shortness of breath and was then diagnosed, let's say, with pneumonia or asthma. Okay, so where could you find the answer? The answer for this particular section, you can find it on your admission booklet. So remember on our first webinar, there you have your admission booklet. On the very first page, it says there the reason for admission and of course your subsequent diagnosis. Okay. Do you have any question with this particular section of your care plan, of your evaluation station? No question. To be honest, evaluation station is one of the easiest. Why? Because you're just basically rewriting the things you've written from your previous stations. Okay. Because remember, you are evaluating the care you've given. Okay. You are evaluating the care you've given. So basically, you're just rewriting the things you've written during assessment, during planning, the medications you've given during implementation station. Okay. So that's it. Any questions so far? That should be easy. Yeah. So one way of writing the answer here is, let's say, John Snow was admitted due to shortness of breath and diagnosed with, let's say, asthma or exacerbation of asthma. Okay. Another one is, let's say, the patient was admitted due to pain and abdominal pain, and the patient was diagnosed or with hernia. And let's say the patient underwent a hernia repair. Okay. So that's it. Any questions so far? No question. So the second criteria for evaluation station is record the date of admission or referral to specialist team. So on the examination, again, I think I mentioned this already in our previous webinar, you could write the word today to refer for the date. Alternatively, you could write the date of your examination. Okay, so if on this section you will be writing today, that should be correct. If you're writing the date of your examination, that is also correct. Okay, so probably let's say 70% or 80% of fails on this particular station is because of this section. Okay, candidates tend to forget to write something here. Okay, because you will easily miss this part of your evaluation station. So please do be careful when you're writing your evaluation station. Please do not miss any of the sections of the document. Okay, so Emma, it says here a referral letter, a referral to a specialist team. Okay, so there are two possibilities or two scenarios wherein you might be writing a referral letter. Okay, so it's applicable for the scenario for malnutrition, and another one is for depression. Okay, so if you're doing that particular scenario, you might be tasked or asked to refer the patient to, let's say, a dietitian, or another one is refer the patient to the community mental health team. Okay, so those are the possibilities on your examination. So the third section um, of your evaluation letter for the old test of competence is to identify the main nursing needs. Okay, so this is how it would look like on your paper. So an example is below. So let's say one was experiencing pain with a pain score of 4 out of 10. So if you remember, this is one of our problems during our planning station. So you're just basically writing your two care plans and the other problems you think the patient experienced during assessment station. Okay, so what are the possible answers here? Let's say the scenario is all about, let's say, Jon Snow, who's experiencing asthma. You could write here shortness of breath. Okay, let's say Jon Snow was experiencing shortness of breath with a respiratory rate of 33, something like that. You could also say John was anxious about going back to, let's say, intensive care unit. You could write something about anxiety here. So you're just basically writing your two identified problems from your care plans and the others. So it's just like the problem list. Okay, this section of the document is your problem list. Let's say another one is, let's say John is a smoker. You could write it here as well. Let's say John is non-compliant to medication. You could also write it here because that is also a problem. Okay, that is a problem that you had addressed during the patient's stay in your unit. If you could see, we are now using past tense because remember, it's an evaluation letter. You're evaluating the care you've given or you've provided to your patient. So if you have, like, let's say, a good care plan, that will translate to your evaluation letter. Next, assessment criteria number 4, outline the nursing care provided. So the things that you provided to your patient, let's say you administered analgesia, you will be writing it here. So basically, you're rewriting the things you've written on the section of your care plan which talks about the nursing care provided. Remember, you have two care plans identified during planning. So let's say let's say the example below, monitored observation and escalated as per news policy. You will be writing it here. So, Emmer, we have like 8 in each care plan. So, do we need to write everything? Just select what you think is more relevant to your patient. Let's say in your pain care plan, you've given analgesia. You will be writing it here. Say administered analgesia and monitor its effectiveness. Let's say the patient was also anxious. You talk about, let's say, provided, let's say, a quiet and a calm environment. You could write it here. Okay. So in past tense, all right? Because remember, again, this is an evaluation letter. You're evaluating the care you've given to your patient. So assessment criteria number 5 is this should be on the next page of your evaluation letter. So you have to outline the current ability to self-care based on the person's care, if applicable, or if the person's current spiritual and family care needs, again, if applicable. So on your care plan, if you're doing the new old test of competence, remember on the other side, there is a section there which talks about the patient self-care activity or what the patient could do independently. So again, you are rewriting that section here. So probably if you've written like a lot, just select like 4 or 5 of those and write it here in past tense. Let's say an example is written on your screen. Let's say one was able to perform proper hand hygiene. Okay. Let's say another example is one was able to cooperate with, let's say, with the with the vital signs taking or with the observations, or let's say one understood the reason for, let's say, um, proper hand hygiene. Okay, let's say, or John was able to, let's say, demonstrate hand hygiene properly. Okay, so or John was able to, let's say, recognize the signs and symptoms of deterioration. So those might be your possible answers here. Again, you are just rewriting what you've written on your care plans. Any questions so far? Most especially from the guys doing the old test of competence. I hope I'm making it clear. So this, again, evaluation letter is kind of chill as compared to the previous stations. So number 6, the document allergies and the reactions. Of course, you're just basically writing what the patient's allergic with. An example is below. Let's say 1 is allergic to penicillin and the reaction is shortness of breath. Okay? Any question? I guess this one is straightforward. So guys, remember, if the patient is allergic to something, most likely that will be one of the traps on implementation station, and make sure to remember that, and that will be transferred or reflected on your evaluation letter. Okay, so you could write it like this in the one on your screen. Okay, so I think this one is easy, and we move on with the next part. So next part is to list the areas of identified for health education or risk associated with the deterioration of the person's condition, if applicable. So the example is below. So I think, let's say for our students, most of them are actually struggling in this section, what to write in this section. So what you're writing in this section are the education that you've given, health education that you've given to your patient, and the things that you think or you deemed um, or the education that the patient needs to receive still, okay? Or the patient needs in the future, okay? Let's say on the one on your screen say educated the patient about proper wound care, okay? Educated the patient about proper wound care. How about ectopic pregnancy? Let's say that is your scenario, okay? So what are the health educations that you might be writing here? Remember, if the patient is had an ectopic pregnancy, most likely the patient underwent a surgery. So the health education should focus on recovery and post-op care. So probably you could educate the patient about proper wound care, educate the patient about proper hygiene, about wound healing. We could also educate the patient about like recognizing the signs and the symptoms of infection. So those are the possible education or health education that you will be writing here. Okay. Um, any questions so far? Another one is, let's talk about, let's say, pain. Of course, you know the answers. All right, we've talked about it on our planning station last time. So probably provide educate the patient on, let's say, non-pharmacologic interventions for pain. Let's say such as deep breathing exercises, your classic diversional therapies, of course. Educate the patient. Let's say, um, what else? What else can you think of? So those are your possible answers for health education. So when you're answering this particular section, think of the main scenario and try to address that. And of course, remember that you will not be able to do all the health education in the world during your shift. Of course, it's a continuity of care. So this section, you could also write the things that you want the patient to receive in the future. Any referrals, you could also write it here. Say, the patient needs referral tissue viability nurse. Okay, they say the patient needs a referral to this nurse. You also write it here. Okay, so that is your health education section. So assessment criteria number 8, we ensure the strike through errors and retain legibility. So again, if you committed any mistake on this section, you will not be given another paper or any spare papers. You just have to like put a strike through. Again, putting a strike through on those arrows should be enough. You could also write your initial and that should be fine. Okay, that should be fine. And we're nearly done with your old examination. So of course, to print, sign, and date your document. So remember on your examination for this particular form, there are 3 dates. So at the beginning on the front page, there is like a date, and then on the second page, the date and transfer and the date when you're signing the document, as you can see on your screen. So for our students, probably 70% or 80% of them failing the station because of not writing the date, forgetting to sign the document and writing their name. Okay, so most of the feedback that we're receiving from the test center are they not completing the documents properly. So again, guys, this is one of the easiest station of the on the examination. Please make sure if you have like ample time or enough time remaining, do use the time to check all the sections of your document. Okay. Again, it's an evaluation letter. You're just basically rewriting the things you've written on the previous station, such as assessment station, planning station, and implementation station. Oh, before I forget, um, the other reasons why our candidates are failing this particular section is, let's say we go back to this. Let's say the nursing care provided. So remember our conversation last time with regards to anxiety. Okay. Some of you on our last webinar said administer anxiolytics and monitor its effectiveness. Of course, when you're writing that in your care plan, that is fine because remember planning. It's your planning for the future. But remember, evaluation. You're evaluating the care you've given. If in case you did not administer any anxiolytics, of course you cannot write it here. Okay? Remember that. Okay? Let's say you did not administer any antibiotics. Of course you cannot write it here because again you are evaluating the things you've given to the patient. Okay? Hopefully that is useful and hopefully my explanation is straightforward. Should we ask the assessor what time is the transfer letter or use the time in the scenario? You could use the time in the scenario, CJ. Yeah. So on your scenario, sorry, I forgot to show you the scenario. On the scenario, the time of transfer is already written there. The only issue is if you're missing to write anything on this section. Okay. So let's say I think on the scenario, if my memory serves me right, let's say the patient is due to be transferred, let's say at 1700s. So that will be the time, the date and time of transfer. Okay. But the date on the bottom, it's asking when are you actually writing the evaluation letter. Okay. So that ends our OSCE evaluation for the old test of competence. I hope that is useful for the guys doing the old test of competence. I'm guessing everyone is excited for the other one.